Hello and welcome to this BMS anatomy revision video. Today we're going through the lungs. Now the lungs are incredibly important organs as they absorb oxygen from the air, which then enters the bloodstream and supplies all the cells of the body. With such a crucial role in survival, it's not a surprise that they, along with other vital organs, are protected by the rib cage. The lungs are situated so that one lung lies on either side of the mediastinum, the central compartment of the thoracic cavity. Each lung has a roughly conchoid shape with a blunt apex that projects up towards the neck, about 2.5 centimeters or 1 inch above the clavicle. The base of the lungs sit on the diaphragm, a dome-shaped muscle that lies at the base of the thorax and separates the thoracic cavity from the abdominal cavity. Your lungs are split anatomically into 5 lobes. The right lung has a superior, middle and inferior lobe, and the left only has superior and inferior lobes, with a feature corresponding to the middle lobe called the lingula. This is because the heart displaces part of the left lung, forming the cardiac notch. These lobes are split from each other by fissures. The horizontal fissure is the boundary between the middle and superior lobe, and the oblique fissure lies between the superior and inferior lobes. If we take a sagittal view of the lungs, we can see a depression where the bronchi, blood vessels, these are the pulmonary arteries and veins, lymphatic vessels and nerves enter the lungs. This is called the hilum. To identify the lung by its hilum, we can use the acronym RALS. That stands for right anterior, left superior, which is the position of the pulmonary artery with respect to the bronchus. Now onto the pleura. The pleura are serous membranes which line the lungs and thoracic cavity. They allow the formation of an airtight and watertight cavity called the pleural cavity, which is important for efficient respiration. The pleura has 2 membranes, the visceral pleura, which covers the lungs, and the parietal pleura, which lines the thoracic cavity. These membranes are continuous, meeting at the pulmonary ligament at the hilum of each lung. Air enters the lungs through the trachea, a fibroelastic tube about 2.5 centimeters in diameter, surrounded by a series of cartilage rings. The trachea bifurcates, splits in 2, at the level of the 4th thoracic vertebrae to create 2 principal bronchi. This is the first bifurcation of many within the lungs. The lower respiratory tract can also be called the respiratory tree, which is used to describe the branching structure of the airways. Each split or generation reduces the velocity of the air entering the lungs and increases the surface area of the lungs, which ultimately increases oxygen absorption. Alveoli begin appearing around generation 17 to increase the surface area of the lungs even more. This complex structure of the lungs means that the surface area is equivalent to that of a tennis court. Isn't that just amazing? So what happens during respiration? Between each rib lies an assortment of muscles which coordinate the movement of the rib cage for respiration. These are called the intercostal muscles. There are 11 pairs of each intercostal muscle, 33 in total, and 3 muscles per intercostal space. The external intercostal muscles, internal, and innermost intercostal muscles. The external intercostal muscles are the most superficial muscles. Their fibers run in a downward and medial direction, connecting the borders of the 2 ribs, from the inferior border of the rib above to the superior border of the rib below. The internal intercostal muscles lie deeper than the external intercostals, but their fibers run in the opposite direction. The innermost intercostals are the deepest intercostal muscles. They have a similar structure to the internal intercostals, but are only found in the most lateral areas of the intercostal spaces. So how do the muscles work together for respiration? Contraction of the external intercostals elevates the ribs to increase thoracic volume during inspiration. The internal and innermost intercostals both have actions on depressing the rib cage during forced expiration. Contraction of the diaphragm causes its shape to flatten out, which decreases the intrapleural pressure, leading to inspiration. As it relaxes, the diaphragm regains its dome shape, increasing interpleural pressure, causing expiration. Movement of other muscles, such as the intercostals, also aid in respiration. That's all for today. We hope you've enjoyed this video, and thanks for watching.